So another beautiful Sunday afternoon. Welcome to Ask the Pediatrician, and of course we are here back once again, ladies and gentlemen. Now obviously tomorrow is a very important day throughout the world as it marks World Toilet Day. Now World Toilet Day is a day that usually reminds us of the most important, one of the most important rooms that we need to make sure that we treat it with all the care that it needs, because if not treated properly, it might actually be a source of diseases. It might actually be a source of germs, bacteria that might actually pose a risk on human life, especially children as well, because children in most cases are very vulnerable. So we need to make sure that as they're growing up, we are also teaching them toilet manners, how to take care of their toilets, and so on and so forth. We are not just talking about that dugout toilet right now. Well, due to technology and of course advancement and of course change of culture, there are now small toilets that are typically made specifically for children, and these also need to be made to be cleaned regularly all the time, actually, to make sure that they don't pose a threat to the life of your child as well. So 19th of November is World Toilet Day. Hopefully that you're going to take enough time to check your toilet, and of course going forward we want to make sure that the sanitation aspect of the toilet is perfect, is on point as well. Obviously this period always reminds us of what happened last year, and we don't want to make sure that it happens this year as well. We want to make sure that where sanitation is concerned, we are on point as well. Today on the program, we are discussing constipation in children, and my guest on the program is Dr. Kanta Chndwe, who is a pediatrician as well. He's been here once. This is his second time he's coming through. He's going to take us through constipation in children. How can you tell that your child is constipated, and of course what are some of the signs, what are symptoms, and is it a treatable condition, and how serious is it? Does it come with complications, and so on and so forth? So for your contributions, you can simply send us a text on that number that is on your screen, and Dr. Kanta should be there to respond to your text messages. Dr. Chndwe, good to see you once again. It's been a long time. I think it's been about 2 or 3 months. So
I think so. I didn't know it was that long. Nice to see you again, Nelson.
Time really flies.
Yeah.
Good to see you once again. Yes. Today we want to take a look at constipation. To start with, what is constipation?
Okay, so the term constipation actually, without really getting into the technical medical definition, it just essentially says somebody's having difficulties in opening bowels. Okay, they're having problems in passing stool. Now I know commonly when you hear the word constipation, the first thing that comes to mind is somebody has not been going to the toilet. Mm-hmm. That's like in general when people talk about constipation. So even just in adults and in children, that is a component of constipation, but there are other things that you would consider as constipation. For example, if somebody is having pain when going to the toilet, if somebody is having hard stool when they're going to the toilet. So all those things fall under the definition of constipation.
Interesting.
Yeah.
How common is constipation among children?
It's quite common, actually, very common. Even most people don't think that in children it's a big thing, obviously, because children will not, especially those who have just been potty trained, will not really say they're having difficulties. They'll think maybe it's part of the normal process. But in terms of the children that we see, it's quite a common condition. And if you look at what we call pediatric gastroenterologists, these are essentially pediatricians who are specialized in the stomach and intestine problems. So they see even up to a quarter of their patients have constipation. So it's a very common condition.
One might ask, what causes constipation?
The causes of constipation are broad, especially when you look at children. Okay, so if we go back to the definition, if a child is taking a lot of days without passing stool, if a child is having hard, painful stool, or even if they're having blood, the causes could be numerous. One of the main things is diet, of course. We know that eating a high fiber diet, being well hydrated, taking a lot of fluids, that helps your bowel movements. And so depending on what this child eats, that might predispose them to constipation. And of course we have to look at other things that could be congenital. Maybe the child was born with an abnormality of the intestine. That could be causing constipation. Some medical conditions as well have constipation as a symptom. So we have to screen and say, is this just constipation or it's coming from a bigger medical problem? So even just psychological things like stress in children, a lot of stressful events in children can manifest as constipation. So when you talk about stress in children, you'd wonder what would a child be stressed about? All they do is playing, they eat and they sleep, they watch TV. What could they be stressed about? So an example would be, let's say in a home where there are problems, maybe you have separation of parents, fighting in the home, moving from one home to another, moving from one school to another. So they have to change friends, they have to change the environment. That in itself is a stressful situation for a child. So that can manifest as constipation.
Interesting.
Yeah.
Earlier you talked about not having normal normal production of bowel, or not really going to the toilet more frequently.
Yeah.
Exactly. What do you consider normal bowel? How many times should a child really go to the toilet?
Good. That's a very vital question. Huh? Although it may look as simple as that, but in answering it in terms of children, we really have to take a planned approach. So I always like to make inference to the adults, even though I take care of children. But if we start with the adults, for example, if you took a sample of 100 adults and you ask them, how many times do you go to the toilet? You'll get different answers. So one will tell you, I go every day, once a day. Another one will tell you, let's say, I go 3 times a week. And that is normal for them, as long as they're not having things that would be considered as difficulty. They're not having pain, they're not having blood, all those things. So it's normal for them. So now bringing it down to children, unfortunately or fortunately for children, we don't look at them as a group. We have to break it down into age groups. Okay, so that has a lot of clinical use. So if you look at, we have categories like what we call the neonates, those who are below 1 month. We have the infants, those who are below 1 year. We have the toddlers, who are 1 to 3 years. And then we have preschool and adolescents. So for each age group, you have different types of what is considered as normal bowel movement. Okay, so what is considered normal for a neonate, that is for somebody who's less than 1 month, is not considered as normal for somebody who's an adolescent. So for the neonates, or the baby who has just been born, the first few weeks you find that they're passing up to 4 to 6 times a day. And that is completely normal. Others, it might even go up to 8 times. But as they grow older, it becomes less and less. So maybe let's say about 8 months, 7 months, they are going to the toilet maybe 2 to 3 times a day. Okay, by the time they're reaching preschool, it might be once a day or once every other day, and that is considered normal. So preschool, and maybe by the time they're becoming adolescents, they would have gotten into the adult pattern of opening bowels. So that is considered as normal, as long as they're not having these other symptoms that would be considered as they're having difficulties. Yeah.
Having said that, let us quickly get into the symptoms so we can understand it better, really.
Yeah.
What are some of the signs and symptoms that perhaps this child might be constipated?
Okay, that's very good. So some of the things, the common things that you will see, of course, I'll start with what is considered as constipation out there. So not opening bowels for a long time. So you find that, so it's important to know the patterns, the normal patterns of your child. If I know, oh, my child opens bowels every day or every other day, and then all of a sudden the child is not going to the toilet for 4 days, 3 days, then I know this is considered abnormal for my child. So number one, knowing the normal pattern of your child is very important. I know when we toilet train our children, so they're talking about maybe around the age of 2, 3, they start going to the toilet on their own, and we really don't check on them. And as long as they say, I want to go to the toilet, we let them go, and we really don't know what's happening in there. And so number one, not passing stool for a number of days. Number two, the child will start fearing going to the toilet, because whenever they go to the toilet, it's painful. Why is that painful? Because they are passing hard stool or bulky stool. Okay, so they'll stop going to the toilet. They'll try and avoid going to the toilet, but that makes it worse. It becomes a vicious cycle now. So they say, I'll hold off going to the toilet, and it takes even longer. So maybe they'll stay 5 days, 6 days until they can't hold it anymore. They go to the toilet, but by that time, the stools are even more bulky, they're even harder, and so it would even be more painful. And so they'll fear going to the toilet even more. And so that's another complaint. If you ask a child how was your how are they opening bowels, they'll complain, no, it's hard, it's painful. And then a very common symptom is abdominal pain. So children who always complain about abdominal pain, but they're not having any diarrhea, they're not having any vomiting. So every other day they're saying abdominal pain. It's a very common cause. In fact, I would say it's the number one symptom that we see in children with chronic constipation. So what you normally, they start adapting to that. So one, they want to avoid going to the toilet, and two, they will stop eating. So they will become very picky in their eating. So this child has been having good appetite. All of a sudden, they start eating small amounts of food because they know that if they eat a lot of food, the next thing they will have to go to the toilet, which is very painful. So avoiding of food, complaining of abdominal pain, not going to the toilet for a number of days, all those are components of symptoms of constipation. And then, of course, that avoiding of going to the toilet, you find that some children, when they feel the urge to go to the toilet, they would rather sit in a corner and just fold themselves so that, you know, they're rocking themselves back and forth until that urge passes, and they continue playing. So they're trying to withhold the stool as much as possible so that they avoid the pain. Yeah.
When a child is constipated, does the nature, the color of the fecal matter also can it also be used to tell that, you know, perhaps the child might be constipated?
Yeah.
Just apart from, you know, the stool being a bit harder, does the color change?
The color not so much, because mainly what determines that, of course, is the diet. And that's why I keep emphasizing knowing the normal stool pattern of the child. So if you know, okay, this is a normal color for my child and this is a diet that we are on, so it's expected. But in terms of constipation, the major component is the stool being one, bulky, and the stool being very hard. So the color really there is not really a predictor to say if there's constipation, the color will be this and that. That's really not a marker of constipation. Yeah.
The number that is on your screen, that's the one that you're using to send us messages on. So you can send us a text message on 0955 5016, 0955 5016. You can send us a text, and Dr. Chndwe will be there to respond to your question. Remember that we're discussing constipation. So if you have seen any unusual pattern of toilet manners by your child, you can as well want to find out from him exactly what you should consider normal, what you should not consider normal, and so on and so forth. And of course, in case your child is constipated, what you can do about that as well. Let's get to you. Does constipation really come with any complications? Are there any complications that can come as a result of constipation? And is it a serious problem, really?
Okay, yeah. It is quite a serious problem in the sense that if you're talking about, even if you look at the age group which is most affected by constipation, you find that those who are just maybe just they have undergone toilet training. So we're talking about toddlers, 2 years, 3 years, 4 years, around that age, and even those around 6 years. So that's like the 2 to 6 years. That's a very common age for constipation. So some of the things that we fear because of the consequences of constipation, number one, these children will start avoiding to eat. And we know that that's a very crucial period for the development of a child, not only for brain development, but also just the nutritional status of the child. So if they are not eating, that's a big thing. So number one, they can be predisposed to malnutrition, some vitamin and nutritional deficiencies. Then number two, looking at the effects of itself of constipation, abdominal pain. So that really reduces the quality of life of a child. You know, we say a child's function is to grow and play. Okay, so if the child is having abdominal pain every now and then, One, they don't want to go to school. They can't go to school because they're having abdominal pain. They want to just sit and lie down until the pain goes away. So the quality of life is compromised in that sense. They don't want to socialize with friends or with family. But the other thing is, because of that hard stool they are passing, they might get some injuries down there. So sometimes you may find sores, what we call anal fissures. So they may start bleeding. And also, because of the difficulties in passing such types of stools, they may develop piles or hemorrhoids. So you have all these complications which are related to the intestine, but of course there are other non-intestinal related complications, such as it can affect the urinary tract. So you may find that they start having urinary incontinence. So this is somebody who has been toilet trained, but all of a sudden they start weeing on themselves. Another complication would be like you start having, because of the chronic harboring of large stools, the intestines start becoming dilated, the rectum starts becoming bigger, and you have overflow of stool. So you may discover that this child is toilet trained, they're going to school, but whenever they come back from school, their underwear is soiled. And you start asking, but why didn't you say you want to go to the toilet? All those things, without knowing that this is actually just a complication of constipation. So it's one of those things that parents do not associate with constipation. They say the child is soiling themselves for some reason or the other. Yeah.
So at least at this level, we can safely say constipation is a medical problem.
It is a medical problem, yes.
All right. Well, quite a number of people in the background have been trying to call us, I know, well, but unfortunately, you can only communicate with us via text messages. So if you have any serious questions that you'd love to ask Dr. Chndwe, please feel free to send us that text message, and he will be there to respond to your message. A couple of messages have come through. But even before I jump to the messages, let us look at diagnosis. How is diagnosis done for constipation? Constipation in children?
Okay, so at the point that if we're fortunate enough that the child is brought to the hospital with some of these complaints, of course the parent might not say this child is constipated. So like I'm saying, one of all those symptoms we're talking about, maybe that will be the main complaint. So I mentioned number one would be abdominal pain. So the parents will come and say, our child has been having this chronic abdominal pain for weeks or months now. Our child has been soiling the pants. Our child is not eating. Our child is is losing weight, all those things. So when we pick it up from there, the number one thing that we do is take detailed information, what we call a detailed history. So we ask specific questions. Depending on the answers, it leads us in one way or another, and we try and dig out, does this child have symptoms of constipation? So that's the number one, the most important thing when you're making a diagnosis of constipation, is getting details from the parents. And that's why it's very important for a parent to know what's the normal pattern for the child. Because we really go into those details and try to dig them out. Then after that, the next important thing is to do an examination. So you do a physical examination. It's a simple physical examination, looking at the child's nutritional status. You examine the abdomen of the child, see if you can find any things pointing to constipation. You examine, of course, down there, look at, is there anything happening? Do they have the complications like these anal sores we're talking about, the anal fissures, the hemorrhoids we're talking about? So you do a full examination. Just on those two, just getting a history and doing examination, you can actually make a diagnosis of constipation. But of course, if you are thinking there are other things that could be causing this constipation, you can do investigations related to that. But in general, investigations for constipations are very limited. We may do things like an X-ray just to see if we can see any fecal matter within the intestines. So generally, it's just a physical examination and a history.
We get right straight to the text messages. The first one here is coming through from Michael from Kafua. Yeah. Thank you so much, Michael. He says, good work, Doctor. Doctor, what causes puffing too much, and how best can it be reduced?
Okay. Puffing, I assume he's saying flatus, passing a lot of gas.
I think so. I think that's the sense I'm also trying to get there.
Yeah. So specifically, I hope is alluding it to in children. That is. It could be a number of things actually. It's a symptom of a number of conditions, and it's not really specific to one thing. So it all falls down in what other things are associated with that. Is it abdominal pain? Are you getting bloating, like abdominal distension with that passing a lot of gas? What is your diet? What are you eating? Are you eating things that, because we all have bacteria that help us with the digestion in the intestine. What type of diet are you on? Is it producing a lot of gas? So there are all those aspects that we need to ask to say where is this passing a lot of gas coming from? So it's a general symptom. It's nothing specific to say if you pass gas, then you have this condition. Yeah.
FK in Mazabuka says, can a 6 weeks old child constipate?
Very good. That's a very good question. In fact, it's a component we didn't mention. So constipation can be seen from children as young as just they were born 1 week old. They're less than 1 month, like I mentioned, the neonates. The only difference is that in children who are very young. So sorry, she said how old is the child?
6 weeks.
6 weeks, yeah. So the only difference is that the younger the child is, the more likely that the constipation, you really have to think about maybe congenital abnormalities. Was this child born with normal intestinal tract? Was this child born with normal, the anal structure down there, is it normal? The muscles that close the anal area, are they normal? Are the nerves that control the intestinal movements normal? So whenever we hear a child who's constipated and they're less than, let's just say 3 months, the younger they are, then we start, that's sort of a red flag, and we have to start thinking we have to investigate, is there something that the child was born with? One common condition, of course, that is a cause of constipation in that age group, in the neonates, is what is called congenital megacolon or Hirschsprung. So essentially what this is the nerves when forming, the nerves that go to the intestine and they help move the stools, did not form very well. So they are unable to move stool, and the child, the stool tends to accumulate in the intestine, and the child is unable to go to the toilet. So that's sort of one of the common causes of constipation in that age group. So I'm not saying that's what that child has, but that's essentially that child has to be, if the child is having constipation at such an early age, we have to evaluate to see, well, is there something that the child was born with that can be corrected maybe surgically, or it's just maybe the function, or it's maybe the child is on. We have to ask, what is the child feeding on? Is the child being breastfed? Is the child being formula fed? Okay, so in this day and era, some parents who are unable to breastfeed will opt to give formula feeds, and we know that children who are on formula feeds are most likely to be constipated than a child who's being breastfed. So we have to ask all those questions.
Derek, Northern Province, and Porokoso to be specific, is asking, why is constipation so common among children in the world today?
So the number, I think it could be a number of things, but of course, I mentioned this, when children have just trained to go to the toilet, they're just now becoming independent. They don't know what's normal and what's abnormal. So I keep on repeating, we have to know the normal patterns, what the child is going through. A lot of children, when they go to the toilet, they have difficulties. It's rare that a 6-year-old will come and tell her father or her dad that this is what happened in the toilet. They sort of try and keep it private and try and deal with it themselves. So they don't tend to get help early, so that could be a risk factor. But of course, we also have to look at now the diets that we're having in this day and age. You find that we are very all busy, we're leading busy lives, and some of us find it difficult to prepare healthy meals for our kids. And so we do a quick fix. Quick fix means giving them processed foods. Okay, processed foods, fried chips, takeaway, all those things, instead of the healthy vegetables, the healthy fiber that people in the olden days used to take. And so that really has contributed to the number of cases that we are seeing in terms of constipation, not only in children but in adults as well. So diet is number one. We're not taking enough fluids, and also, again, like I said, toilet training of these children. Yeah.
Does ginger help people with constipation?
Ginger I know has many health benefits. But specifically, if somebody has developed constipation, it's not really one of those treatments we say, take ginger, that's all, forget about it. Yeah, so it may be in the bigger picture of things, it's not a treatment of constipation per se, but for other health benefits, yes, you can take it, but not really as a treatment of constipation.
Mrs. Puri from Mambwe says, what can you give to a constipated baby who's less than 1 year old?
Okay, so I guess we go into the treatment options. Maybe I know we haven't covered the treatment options.
Exactly. So I think we're going to respond to this one immediately as we get to obviously treatment.
Yeah, we cover treatments. Yeah.
I also have Francis Chikonele from Zabuka, who says, I'm following your program, guys. Please, Doc, my question is, if the child is constipated, is there anything you can do to help the child to come normal again, or what is the medicine you can give to that child? So obviously even this treatment, one we should be able to respond it the moment we get to the treatment. You're still watching Ask the Pediatrician. My pediatrician today in the studio is Dr. Kanta Chndwe, and we are looking at constipation. Just about now we go for a break. When we come back, we get now into treatment. We get into treatment, and obviously Francis and Mrs. Piri's questions will be answered as Dr. Chndwe will be explaining on the treatment for constipation.
One of Zambia's leading pioneer internet service provider, Zamnet, offers services like broadband fiber, fixed broadband wireless, data bundles, domain name registration and hosting. Zamnet also offers bulk SMS system and web-based system. We also offer hosting solutions like web hosting, web development and network design. For further details, email us on sales@zamnet.zm. Zamnet, nobody delivers IT better.
The hour has begun to learn and have some fun with friends and everyone. Now, today, if you're bored at home, this is the perfect show to learn and how you grow. You grow. Make it your best moment today. Turn on set lights, cause we'll have to share. Wordings of fan we'll bring to you. It's Q Club. Q Club is the best for you and I. Lift your voice and raise your hand to sing. Wordings of fan we'll bring to you.
Welcome to Faith Avenue.
Guide man.
Okay.
The way you should test.
Right here with your brother Minister Cage.
Twalumba mwami pakutoba nyantomwi.
Shine like a light. Shine like a light.
You know, people with ideas have no power, and people with power have no ideas.
Now, being a man of God, after a fervent prayer, you sit down.
Thank you so much for staying with us. My guest on the program today is Dr. Kanta Chndwe, who is a pediatrician and of course helping us understand the complications that may come as a result of constipation. Now, Dr. Chndwe, let us get straight into treatment.
Yeah.
Exactly. After diagnosis is made, how is constipation treated?
Okay, good. So at that point, once we have looked at the history of what the child has been going through, we've done an examination and we're sure this is constipation. So the number one, when you talk about treatment, is actually now counseling of the child and also the parents. Most of the times it's the parent. But of course, if the child is at an age where they're able to understand the condition, we would try and involve them in that treatment as much as possible. So we're talking about, if it's a very large group, wide group that we're talking about, we may be talking about somebody who's 2 years old, 1 year old, maybe talking about somebody who's 10, 11, 12 years old. And so the counseling aspect, what is involved in that counseling aspect? Number one is to see it's a life change. It's a lifestyle change that needs to happen before you give any type of drugs. Okay, so lifestyle change, what do we mean by that? Number one is the diet. We usually go through a step-by-step diet of what the child takes at home, what they have for breakfast, what they have for their break time around 10 hours at school, what they have for lunch, what they have in the afternoon, and what they have for supper, and how much fluid intake they're taking, what types of drinks are they taking, are these carbonated, are these pure fruit juices, and so on. So once we go through that, if we identify certain deficiencies that the child is not supposed to be taking this, so much of this, or this actually we can cut it out of the diet, we advise the parent together with the nutritionist. We try and work out a diet plan for the child and advise what types of foods, depending on, of course, people come from different types of economic backgrounds, and so we try to work with what is available for them and say, actually, this is good for the child in your setting. You can feed the child this in the morning. In the mid-morning, you give a fruit, give a pure fruit juice, things like that. For lunch, we advise you to give this type of food. So number one, if they change that, we're trying to increase the fiber content of that food, and also we're trying to increase the fluid intake so that the stools that are being formed have got the right amount of bulk, they have got the right amount of moisture so that it's easy for the stool to pass. So once we establish that, the diet component, now we have to look at other things. So I mentioned that some of the causes include stressful things around the home or happening around the child. So we have to address those things as well. There's no point in treating constipation if maybe the child doesn't like the school that they're going to, or maybe the child is being bullied at school where they're going to, or maybe there's a bigger problem in the home. Parents are separating, they have lost a parent, parents are fighting. So all those things, they have to be addressed depending on what we dug up from the history. So really number one is the counseling component, diet, addressing the stressful environment if the child is in such a stressful environment. And then, of course, once we address that, then we come to drugs now that we can give. So there are different types of drugs that we can give. Even in children as young as the neonates that we mentioned, those who are below 1 month, there are certain drugs that we can give. So the categories of drugs include those that soften the stool. Then there are those that help with the movements of the bowel, because we know that the bowels are constantly contracting and trying to push stuff down. So there are drugs that will help in that. And then some of the children who come in, because they've had constipation for such a long time, you find that the stools have just now become so bulky. They have become so hard, such that now the normal stool is just passing around that hard stool, and they are soiling themselves. And sometimes the parent might actually say, this child has diarrhea, because all that soft stool is passing around the hard stool. It can't come out on its own. So there are procedures that are there to what we call disimpaction, to remove that bulky stool before we even start giving other drugs. So the options are there. There are suppositories that we can insert. There are drugs that we can drink to make the stool soft. But number one, of course, is counseling. It involves lifestyle change of the parents and the child. So it's a family affair.
Interesting.
Yeah.
Just as you are explaining this, somebody whispered in my ears here.
Yeah.
Exactly. If a child has eaten too much or giving too much food to a child, can that cause constipation?
Okay. If a child has appetite, lucky for you. A lot of us struggle with children who don't want to eat. So it depends on the type of food. What are you giving the child? Are you giving the child fried chips, deep fried things, and that's what they are feeling on? So yes, that would predispose them to constipation. But if you are saying you're feeding the child a lot of fiber and the child is eating a lot of vegetables and they are so full, that will not predispose them to constipation. Actually, that helps their bowel movements and they have taken enough fluids. So if the diet is okay, is what we call a balanced diet for the child, it shouldn't pose a problem. Like we mentioned, that time is very critical, especially for those below the age of 5. Feeding and nutrition is a big component in terms of how they grow, how they develop, not only within their body, but also how their brains develop, how they'll do at school in future. So that period in terms of nutrition is very critical. So it's not, constipation is not one of those things you say will start starving the child so that they don't have hard stool. You just have to feed them the right type of food. And of course, they won't have those symptoms.
Mungwala Stephen from Manyinga says, good afternoon, Dr. Chndwe. What is a problem when a child is taking a lot of soil, and what are the benefits? I think children are very good at eating soil.
Okay.
Exactly. Maybe the additional question could be, eating soil, does it also contribute to constipation?
Definitely. Okay, so the term that we use for eating such things that are not really don't have nutritional value is pica. Okay, so pica could be a symptom of a lot of deficiencies that can be going on in the child, nutrition deficiencies. For example, iron deficiencies and other mineral deficiencies. So you start having this craving. Commonly, in society, you hear of pregnant women they like eating. Mm-hmm. Exactly. So that's one craving that you get. But even in children who start picking on these things, it could be a sign of maybe some deficiencies that are going on. But definitely, it's not a healthy habit. Of course, there are the minerals in that soil, but it's not. Doesn't mean that's where they get their source of minerals and vitamins. So we know that they can pick up a lot of things. There are parasites in the soil. Okay, there are animals that leave droppings that have got very dangerous parasites for the brain that can develop meningitis, bad for the lungs, bad for the liver. So eating soil is definitely not a good thing. But it could be a sign that the child has some deficiencies on, so they have to be checked up.
Esnat Lungu from Quito is asking on what diet reduces constipation in children.
Okay, good. I think we touched that a bit. So the diet that we're advocating for is a diet, number one, that is rich in fiber. So without really advertising certain products, so there are certain cereals that are rich in fiber. So actually, you can talk to a nutritionist, or even when you go to you can read the nutritional contents of some of these cereals. There are some that are really rich in fiber. The secret is to avoid refined things, the quick fixes. So vegetables, fruits are very good sources as well of that fiber. So that will help movements of the bowel. But it doesn't make sense just to take fiber, rich fiber on its own. It has to be well hydrated. So taking water is very important. We live in a climatic condition where it's very hot, as in this summer it's quite hot. So we have to take even extra amounts of fluid for that kind of thing. So I would say just taking enough fluids and taking enough fiber. And that doesn't mean, because I've come across parents who have said, because of that we don't give our child meat, we don't give our child chicken. Well, children do need protein, but I'm saying in addition to that, they have to have a good amount of fiber in their diet, vegetables and fruits.
Interesting. Earlier, I think if I quoted you very well, you talked about when you're doing diagnosis and, of course, treatment, you might as well want to consider the history, isn't it?
Yeah, history is very important.
Exactly.
Yeah.
So now, in line with that, can constipation also be genetic?
Genetic, yes, in the sense that I had mentioned that certain medical conditions could have constipation as a symptom. So if you have what we call metabolic conditions, so they say problems with your thyroid, and sometimes even diabetes actually could be a manifestation. Constipation could be a manifestation of those conditions. So some of those bigger conditions could be genetically linked. So they are passed on from the parents essentially. So, but as constipation on its own, usually no, it's not a component. It's not something that you pass on to your child, unless it's under a bigger umbrella of another medical condition. Yeah.
This one says, it's coming through from George in Petauke. My child, 13 years old, despite having a diet rich in fiber and fluids, takes 5 to 6 days to visit the toilet, and her fats are smelly. What's your comment about this?
Okay. So number one, it's good that they're even looking at the diet, but of course I would really want to know the details. What does he consider to be a good diet rich in fiber? Okay, so maybe his definition of what's a fiber-rich diet might be different. So we still have to go through that even with a nutritionist or with a clinician to say, okay, to confirm, is this a good diet? Number two, we are saying, what's a fluid intake? If this child is having, and like I said, there's no point in just taking good enough fiber, but if you're not taking fluids, or if you're taking lots of carbonated drinks instead of taking water or pure fruit juices, then definitely your diet won't do much to help your constipation. So those are the first two aspects. But of course, number three, we have to say, was the child treated for constipation? So what really happens is, if you discover that the child is not going to the toilet, you try and change it because you've heard that diet helps, so you try and change the diet. But we're forgetting that the stools already are hard, and there's already hard stool in the bowel, and this has been going on for a long time. So that diet will not change what's already there. So first of all, that child has to be treated. We have to flush out what's there that has accumulated in the period that the child has had constipation. And then we start working with a diet, because now the bowels are nice and clear, and then we can start afresh. But there's no point in just changing diet when the stools are still hard when the intestines are still have hard stool. It will not move on its own or with a diet. First, we have to flush it out with the medication that we mentioned, and then you can pick it up from there. And I think we didn't mention, when we talk about constipation, treatment, it's not something that you treat for a week and it goes away. It's a very long process. Okay, so lifestyle change is a long process. It won't take a week or 2 weeks. But also the medicine that we give, usually we find that we don't give it for 1 week, 2 weeks, or 3 weeks. Otherwise, you can give it for 3 weeks and the child starts passing stool normally, and we stop the medication. The chances are that it will recur again. So the treatment is a very long process, and it includes follow-up and just reinforcing to say you're doing the right thing, and we continue doing it. Even if the child now starts having no more stools, we tend to stay on the treatment for a longer period until we know, fine, the lifestyle has changed, the diet has changed, the bowels now know how to move stool out, and then we can wean off the drugs.
Mrs. Chimboka, is constipation related to diabetes?
Yeah. So I think I already touched on that. I gave an example that diabetes is one of those conditions that can have constipation as a component, as a symptom. So definitely, yes.
So when somebody is diabetic and they have constipation at the same time, how is the treatment done there?
So the good part is, I know most throughout the country we have good follow-up of people who are diabetic. So we have diabetic clinics, and of course clinicians recognize it very well that it can be a component of such. So the clinician will try and work out, of course, diet is very important in diabetes. So that diet that will be planned for you not only takes care of your sugar level control, but it will also take care of constipation. So they're trying to work out a diet that treats both. Okay, but of course, some of the complications of diabetes include nerve problems, whether it's in the foot, but also in the nerves in the gut. So that could be a component of the complications of diabetes. So in as much as possible, when we're treating children and adults with constipation, we try and avoid those complications. Before we get to those complications, we try and control the sugar levels. Yeah.
We get to Livingstone.
Yep.
Mr. Mdenda here says, my child 10 months old has been experiencing pain when passing stool with blood for 4 months now.
Yeah.
The stool is in a small hard pellet-like form.
Yeah.
We have been to the hospital where we were just advised that to continue breastfeeding. It's not resolving.
No.
What is the treatment?
Okay. Very good. 4 months, we said?
Yeah, exactly. The child is 10 months old.
10 months.
Exactly.
Has been having for 4
experiencing
months.
pain and bloody
Stool.
stool for about 4 months now.
Good. So it essentially started around 6 months. Isn't it? Okay. What I had mentioned to say, the younger the child is, the most likely that the child could have a congenital problem. Like I said, maybe the nerves didn't form very well in the intestine. So there are certain questions I would like to details that I would like to ask him. Like when the child was born, when did they start passing stool? Did they start passing stool in the first 24 hours? Did they start passing stool after 48 hours? So those are very important pieces of information that we need to get before you make an actual diagnosis why this child is having constipation. But because the child is 1 year, we really have to dig in and say there's nothing that we need. Maybe it's a surgical problem, it's a congenital abnormality. If we screen and make sure that all those things are not there, then we can start now treating the constipation on its own. We had mentioned that because of those hard stool and that straining, you can have cuts down there and the child may start having blood. So those pellets are just, if the stools are looking hard and pellet-like, it just shows that the stools are staying in the rectum so for such a long time. Water is being drawn from the stools and they're becoming so hard that they form, they come out as pellets. So definitely that's a sign of constipation, but we just have to get to the bottom of that. So first of all, screening and make sure that there are no congenital abnormalities, and then we can treat the constipation. Just to say that they should continue breastfeeding, that's not enough. And the child is now over 6 months, so definitely they've started taking other foods. So we have to look at the diet as well. What other complementary foods have they started giving apart from the breastfeeding? So we have to go through the diet, make a dietary plan, then definitely that constipation has to be treated. It can't go, it's already turned into complications of bleeding, so that's something that has to be attended to urgently.
FK once again from Mazabuka. If the child is constipated but feeding very well, puffing and passing urine regularly, is it okay to give medication to the baby? 6 weeks.
6 weeks.
Exactly, a baby who is 6 weeks old.
Okay, so you're saying the child is feeding very well, but
feeding
not
regularly and passing urine normally and just puffing normally.
Okay.
Exactly.
Puffing. That's a passing stool or passing passing. I'm not sure. By puffing, if she means passing flatus.
I think so.
Okay, but the question is a child passing stool? What types of stool that is a child passing? Is it hard stool? Is it 6 weeks? You said. Exactly.
The child is 6 weeks old.
By that time.
Maybe the question, but
yeah.
Here I think let me try to help FK here.
Yeah, please.
He says the child is 6 weeks old. 6 weeks old,
yeah.
Exactly, and is constipated. If a child is 6 weeks old and constipated,
yeah,
exactly. Maybe the question could be, if a child is constipated,
and
how is their feeding rate? Do they feed properly?
Okay.
Do they pass urine properly?
Yeah.
Exactly.
Okay.
Maybe we just look at the two first of all, because we know for sure that when a person is constipated, they usually have difficulties in stool passing, right?
Yeah.
Exactly. How about the diet? Does constipation also affect the diet, whereby the child stops eating regularly, have poor diet, and so on and so forth?
Yeah. So in terms of that age group, 6 weeks, if a child becomes constipated for one reason or the other, again, I mentioned if they are constipated at that so young age, we have to take them for screening to say they don't have these congenital problems, number one. So if we have screened for that and we find they're fine, then we have to look at what are they feeding. Is it breast milk or is it formula milk? Okay, I mentioned that those who are on formula are more prone to having constipation than those who are breastfed. Okay, so if that is taken care of, if the child is experiencing pain because of the constipation, they'll have difficulties feeding. Okay, But sometimes when you reach that point, then you are talking about stools that have become very hard and they have become very bulky. Because of that distension, they start getting abdominal pain and they're always irritable. So feeding might be a problem. And so the parent might just come to the hospital and say, my child is not feeding, he's irritable all the time. I don't know why. And it could be constipation. But sometimes, but that's like you're almost reaching the severe form. Yes, the stools have been accumulated for such a long time, and now there's pain. If there is no pain, maybe it's in the early stages of constipation. The child might not be having abdominal pain, so they might be feeding very well. So the symptoms could be varied. They might be feeding well. They might not be feeding well if they have those now abdominal pain, if they're having pain when passing stool. So it's quite varied.
I have a 2-month-old baby, and it's 8 days. It's 8 days. He has not done poo-poo. Should I worry? Tinta Lusaka.
Yes, you should. The simple answer is yes, you should. 8 days. Remind me the age again.
2 months old.
2 months. So we said in the first few weeks when the baby is born, you're talking about going to the toilet even from like 4 to 6 times a day. Okay. By the time they're reaching a month or two, maybe they're going 3 times a day. And so, but 8 days is a very long time. That's definitely a symptom of what would be considered as constipation. So we have to have that child assessed. We have to look at how's the feeding option. We have to go back again in the history when the child was born. How was the normal stool? Has it always been normal, then suddenly it has just changed? How long ago was that change? So we really have to dig in. I'm a bit concerned when the child starts having constipation at such a very early age. So we really have to go into the history of the birth history, the normal stool pattern that this child started having from day one. And then we can come up with a diagnosis. Is this something that we need to involve the surgeons with? Is there an abnormality in the intestine? Fine. If we screen and there's nothing like that, then we can now start addressing the constipation itself. There's things we can change in the diet, then we can start the treatment options that we can give.
Frederick from Mukushi seem to want to go a bit, specific here.
Yeah.
Do bananas cause constipation?
No, not that I know of. So fruits in general are very good. Actually, bananas are some of those things we're trying to incorporate in a diet when we are making a diet plans with the parents. So bananas are a good source of a lot of things, and even bowel movements. They're very good.
Help me understand something. A child is constipated.
Yeah.
Then perhaps after maybe a few weeks or a few days or so.
Yeah.
Then is it normal to have diarrhea?
Okay, good. I had touched on this a bit to say one of the symptoms that the parents will come and say is that this child is having diarrhea. Okay, when in actual fact the child is constipated. Now, how does that happen? So you find that it's a cycle, like we mentioned. If the child is not going to the toilet, the longer they stay without going to the toilet, the harder the stools become, the more bulky they become. Okay, so your rectum starts getting distended with hard stool. Now, when you're eating, of course, and you're taking fluids, some of that soft stool, that watery stool, will pass around that hard stool. And what you see coming out is like diarrhea. And one of the signs that we see, one of the symptoms is that the child starts, and it's involuntary, the child starts soiling their underwear. So they come back from school and say, why didn't you go to the toilet? The underwear is soiled. And you say, maybe the child had diarrhea. So if that is happening now, every now and then, one of the things that we have to think about is constipation. So yes, it's one of the presentation to say the child is having diarrhea. Then if a parent is told it's constipation, it looks like you're contradicting yourself, but it's a symptom. It's one of those symptoms of constipation. It's just overflow. You have hard stool and you are having overflow of watery stools.
Mercy Livingstone says, my baby is 2 months old and he has taken 9 days without doing poo-poo. What should I do?
Okay, I think it also
it's actually related to the previous one. Exactly.
Yeah, I keep on mentioning I get concerned if I see a baby having constipation at such an early age. That child has to be assessed at the hospital. And some of those things that they'll do, the first thing that the doctor has to do, or the clinician, will dig deep into the history. How was this child born? What happened when they were born? Did they pass two on day one, or they delayed? Have they always had problems passing stool? How is their stool when they're in the first few days of life? How was their stool, and how has it changed now? Once we look at that, we look at the feeding. How is the feeding? Is it just breastfeeding? Is it bottle feeding? Once we have cleared that now, and we know the cause of the constipation, definitely something that has to be treated. Yeah. So there are treatment options for that.
There is a message here from Emily, but I think I would really love you to take a look at it just after the program. This one says, Doctor, please, I'm in Lusaka. I'm looking for a urologist that can operate someone who has a urethral structure at the private hospital.
Urethral structure.
Mm-hmm.
Is it, I'm assuming it's children. We're just talking about children.
Exactly.
Okay. We do have specialists in that area, urologists, even pediatric surgeons. So what I would advise, if they're already being seen and there are no specialists where they're being seen, I'd rather they are referred to a center, for example, UTH, where we have specialists in that area. Definitely a urethral stricture means the child is having difficulties passing urine, and that can have a lot of complications for that system. So they can ask for a referral to a hospital that has a specialist. So in this case, I would recommend they're referred to UTH. Yeah.
As we wind up for today, really, we can as well maybe touch on prevention as the last aspect exactly.
Yeah.
How can constipation be prevented in children?
Okay, so the number one thing I think I would like to emphasize is on the parents, actually not on the child. So the parents really need to be involved in not just the toileting of the child, but what they are eating. We really need to watch what our kids are eating in this busy world, okay? And then we have to be involved, even if they're toilet trained. Once in a while, you need to have that conversation. You need to let your children be so open to tell you what's happening in the toilet, or if not, at least check on them once in a while so that you know they are going to the toilet. Because sometimes you realize, if you ask a parent, when did your child last go to the toilet, they tend to ask a child, when did you last go to the toilet? Because they don't remember themselves. They don't it's not something we keep an eye on every day. So please be involved. What is the child feeding? What is the child drinking? How often is the child going to the toilet? Is he having problems, pain going to the toilet? So that you pick it up as early as possible before all these complications set in. And of course, all these symptoms that we picked up, you have to be aware of them and pick them up quickly so that you can bring the child to the hospital.
Well, Dr. Chndwe, thank you so much for coming through.
Thank you, Nelson. Thank you for having me.
And I hope that our viewers, you did get that. So to these mothers that we have seen who have given us at least a specific age of their child, for example, Macy in Livingston, and of course the other one as well, and others as well have got children who are 6 weeks old, 2 months old, and so on and so forth, and they are constipated, they haven't been going to the toilet. Please, right about now, make sure that you take your children to the hospital. Let them be assessed by healthcare providers, and they will be able to be given professional treatment exactly, and will be able to provide that particular help. Otherwise, I think the information has come out quite well. Messages that I haven't read, especially concerning adult constipation, is because that is not the topic of our discussion today. That's the reason why I just left them out. I had a couple of them where I've had comments from people talking about I've had constipation for 4 years and so on and so forth. We'll create another platform where we can be able to respond to adult constipation, but for today we're just focusing on constipation in children. Thank you so much for participation. Make sure that you join us next week Sunday, same time.